In the world of weight loss injections, it is oftentimes said that Mounjaro is king. But is there actual factual statistical data to back up this claim? Let's talk about it. Hey guys, welcome back to the channel for another video. This one is much anticipated because I have been promising this one for a while. But if you are new here, my name is Brittany and I have lost almost 80 pounds now on Mounjaro, tirzepatide, Zepbound over the course of the past year and almost half now at this point. So I have been doing tons of research into the Mounjaro, Ozempic, Wegovy topic and how they all work and which ones work best. So we are just going to go ahead and jump right on into this video because I have a ton of notes that I want to discuss with you guys. First off, as always, this is not medical advice. You should always speak to your care provider before making any major decisions as far as your dosage or medication or anything goes. Talk to your trusted healthcare provider for sure for definite answers on that sort of thing. So to just jump right on into this, tirzepatide and semaglutide are the medications in Mounjaro and Wegovy, or Zepbound or Ozempic respectively. And they are both GLP-1 medications that are designed to mimic the GLP hormone in your body, which is responsible for blood sugar regulation, appetite, like you're keeping your appetite at a level, like all of that. And then also the treatment, obviously, of diabetes with the blood sugar regulation and all of that. So they were originally developed for diabetes, both of these medications. It was Ozempic or semaglutide and Mounjaro or tirzepatide. And very quickly, doctors started realizing that their patients were losing significant amounts of weight on these medicines. And so this began this off-label prescribing and use of these medicines for weight loss in patients that were not diabetic. And that is something that has been going on for a long time, and people have definitely different opinions about this, but both of these medicines were eventually FDA approved for the use in chronic weight management. Semaglutide is branded for weight loss under the name Wegovy, and tirzepatide is branded for weight loss under the name Zepbound. So I have a whole video on exactly how these medications, especially Mounjaro, works, and I will link that one below. But for like a very quick little synopsis here, I have it all written down. Both semaglutide and tirzepatide mimic the GLP-1 hormone, which again is a hormone that is naturally produced in the body, and it is responsible for blood sugar regulation, the digestion of your food, how quickly your food gets digested, satiety, all of those, or you know that word, hunger, normalizing your hunger levels, and all of that. And both of these medicines will produce or help to produce more, and they mimic, the medication itself mimics that hormone. So it's when the hormone is naturally produced in the body, it quickly diminishes. And so people have different levels of that hormone in their body. And of course, because we're all different. And so what the GLP-1 does is actually stays in there for a longer period of time. It's designed to be a once weekly injection, so the levels are even. It keeps the levels of this hormone even, therefore helping with your blood sugar levels, helping with your digestion to slow it down, helping with your hunger levels. And so tirzepatide was actually the first medication, which is why a lot of people say that this is king, to also mimic the GIP hormone. So Ozempic only mimics the GLP-1, and tirzepatide mimics both the GLP-1 and the GIP hormone. I got a barking dog back here. So again, most people believe that tirzepatide, because of this, is much more effective than its counterpart. So we're going to start with Wegovy, since that was the first one, or semaglutide, since that was the first one that was really developed and it came out first. It was approved for diabetes in 2017, and pretty much instantly it showed this advantage over other diabetes medications. So there are the older GLP-1 medications such as Saxenda and such that have been around for a lot of years, but they were never as effective as semaglutide came out and was. On average, diabetics on semaglutide were losing 15% of their body weight, and semaglutide, which is actually just approved for this fact, was the first medication of its kind to prove to lower the risk of heart attack and stroke in patients that were not diabetics. So semaglutide came out and really sort of overtook the world of specifically diabetes management because it was so effective in comparison to its counterparts. Then in 2022, so just a couple of years ago, tirzepatide joined in on the game, and it is a game changer in comparison to just even the semaglutide. So tirzepatide is a dual agonist, which means that it mimics both the GLP-1 and the GIP hormones. And because of this, both of these hormones work in very similar ways. So you sort of get this double effect over just the Ozempic when you are on the tirzepatide as well. So early clinical trials show that tirzepatide can help people lose up to 20% or more of their body weight. So that's 5% more than Ozempic was showing. It is not 100% understood why tirzepatide is more effective for weight loss, but most will agree that it is because it mimics both of the hormones while semaglutide only mimics one. So far, I do want to put this out there because I mentioned it with the semaglutide. So far, Mounjaro has not been shown statistically to reduce the risk of heart disease or stroke. So in patients that have a higher risk of that, semaglutide still may be the better choice. Now, just because it hasn't been proven yet doesn't mean that it's not true. There just haven't been enough studies. Semaglutide is obviously an older medication, and therefore there's been more studies on it, right? So the Mounjaro just has not had enough studies done. So it very well could reduce the risk of heart attack and stroke. It's just not clinically proven as of this date. Now, we're going to go ahead and compare the two in terms of their effectiveness, and I have some slides here that I'm going to use to show you what I am talking about. So as you can see, the medication here has a color code. Mounjaro is pink, Ozempic is blue. And then it also compares like Trulicity and Saxenda, which are the older agonist medications that I was speaking of, but we don't necessarily need to worry about those, but you can look obviously if you want to kind of check those out on the comparison list as well. But we are just focusing on the tirzepatide and the semaglutide. My daughter just sneezed. She is sitting right over here on her phone, so if you hear anything else, that is what that is. Okay, so we're gonna discuss three different categories here. The first category is fasting blood sugar, which is measured in millimeters per liter. So those taking Mounjaro had levels 3.12 millimeters per liter lower than the placebo patients. So the patients that were given the placebo medication and weren't really on anything, and 1.12 millimeters per liter lower than Ozempic. So if we're just talking about fasting blood sugar, the Mounjaro is obviously way more effective. And that is really something to be said for the diabetics in this community that are taking this medicine for diabetes, that Mounjaro, it seems to be significantly more effective at lowering and maintaining blood sugar levels. Let's go ahead and move on to category 2, which is the one that I think most of us are really interested in, and that is weight loss measured in kilograms. So if you are not familiar, a kilogram, to say your weight in kilogram is 50 pounds, in order to get your weight in pounds, or 50 kilograms, in order to get your weight in pounds, you would multiply that number by 2.2. So if you're trying to look in terms of pounds of what these people lost, then definitely, you can kind of do the math in your head, but you would take the kilogram and multiply it times 2.2. So Here is the graph for category 2, weight loss measured in kilograms. Mounjaro patients lost 8.5 kilograms more than the placebo group, obviously, because the placebo group was not on any medicine, and 4.5 kilograms more. 4.5 kilograms more, which is double, essentially, more than the people that were on just Ozempic. Now, this is definitely a much wider, this specific study, weight loss difference than what I was speaking of earlier, which is that Ozempic helps with average of 15% and Mounjaro 20%. And every state case study is going to be different, obviously, but that just goes to show 8.5 kilograms on the Mounjaro and 4.5 with the Ozempic. So that's a difference of almost it's almost double the amount that people lost on Mounjaro versus the people that were on Ozempic. Now, the final category compares something that I specifically am pretty interested in, and that is side effects. Now, Mounjaro definitely, in this study, and just from what I've heard in terms of specific people speaking on what medicine they have been on, Mounjaro definitely seems to have worse side effects than the semaglutide. And I think that is because of it being a dual agonist, and it is just more effective. So if it's working harder in your body, then your body is more likely to have a response, if you just think about it like plainly. But Mounjaro is definitely more likely to produce digestive or stomach symptoms such as nausea, vomiting, diarrhea, constipation. It seems like people will either have the diarrhea or the constipation, sometimes a combination of both, which was what my own experience was. I personally would definitely have like constipation one time and then diarrhea the next. It was never consistent, but overall, Mounjaro seems to be above the rest in terms of symptoms. And then all of the rest of them, Trulicity, Saxenda, Ozempic, seem to be pretty even on the side effect issue. And that's just comes with the territory. So Mounjaro may give you more adverse effects, I suppose, but it's also going to be, realistically speaking, more effective in terms of managing your diabetes, losing weight, all of the things. So my personal opinion is that I would rather have a little bit more nausea or constipation or diarrhea and know that the medicine is going to be more effective for me. Maybe that's just my, opinion, but there it is. Now, these are all statistical results, right? We're going to talk about some personal results because I actually have some personal experience that I can share with you guys in terms of Mounjaro and Ozempic. I personally have not been on Ozempic. However, I have family that has been on. So me, my mom, and my one sister have all been on Mounjaro or tirzepatide for a prolonged period of time. And then I have another sister that took semaglutide for a prolonged period of time because her insurance covered it. It did at one point. That's another story for another day, but she's a state employee and at first it covered it. So she was on that. Now, in terms of me, you guys know that I have lost almost 80 pounds in a year and a half, and I did lose the weight rather quickly. I lost most of my weight within the first 6 months. I did have some side effects, like I just mentioned, some nausea, vomiting, diarrhea, but overall, nothing that I couldn't handle. It worked very well for suppressing my food noise, suppressing my appetite, regulating my blood sugar. I feel like for the most part, all of my blood work results have been awesome. So I have had a very positive experience on Mounjaro. My mom, who has previously had gastric bypass, had a very similar experience. She had gotten stuck in a point where she couldn't lose any more weight. After her gastric bypass, she had tried the phentermine. She had tried, so many different things, Weight Watchers and keto and all of the things. And when she got on Mounjaro, she finally broke her stall and went on to lose another 40 pounds. And she has said that she would have taken the Mounjaro over having a gastric bypass any day of the week. I've touched on that before. This, in my opinion, Mounjaro might end up being a cure or not a cure, but a replacement for weight loss surgery because it is so much less invasive. Now, my other sister that was on Mounjaro had a very similar experience. She had just had a baby. She got on the Mounjaro and was able to effectively, quickly, and healthily lose all of her baby weight. And it was something that continuously worked. As for me, Mounjaro never falters, right? Now, my other sister that was on semaglutide, she actually, here's a good testament to the side effect issue. She actually started her journey on the highest dose of Ozempic because that was the only thing that was available in our area and she could not get anything else, and she had been waiting weeks and weeks. So our doctor, which we all go to the same one, essentially was like, hey, you can start on the highest dose, you just might have some side effects. And I think this speaks to, you're gonna get a visitor, I think this speaks to the Ozempic difference in side effects, because she had hardly any side effects going from 0 to the 2.4 Ozempic milligram dosage. Are you 4? Yeah. So with that being said, she had like a little bit of stomach upset, but nothing else major. It was not as effective for her. She did not have the same food noise quieting that we have. She would come to my house and say, you know, I can't eat as much, but I still crave things. So for her, the Ozempic definitely was not as effective. And that seems to be what I hear overall from people that take Ozempic or semaglutide over Mounjaro, is that it is not quite as good at quieting the cravings and the food noise as Mounjaro is. She has lost 30 pounds. It has not been as quick. She lost 30 pounds since last September. It is currently March, and she's actually not on anything right now. She's trying to get Zepbound approved, but North Carolina dropped coverage. She's a teacher, and their state coverage, their state employees union or whatever dropped weight loss coverage. So she's not able to utilize that anymore. She's trying to get Zepbound covered, but right now she's on nothing. And she says that, you know, while she misses it, the Ozempic, she doesn't really know that it was that effective for her. So there are some personal stories in relation to that. So what do you think? I would love to hear your opinion, your experience, especially if you've been on both. Let me know down below. But overall, I would say that Mounjaro is king because of the fact that it is a dual agonist. I think that the statistics show that as well. So thank you guys so much for watching this video. I have a lot more planned for you. I have a lot more written out. So don't forget to subscribe and stick around if you are somebody who is on Mounjaro, on Ozempic, and interested in hearing my thoughts and processes and experience on it. Thank you guys so much for watching this video. I hope you have a great day, and I will see you soon. Bye, guys.